month too. But we'll take care of all that for you when you come in. So this is great. I'm out of here. So 3 weeks later, my surgery date, Monday morning. And times of surgery could be different. It could be early in the morning. It's sometimes coming in at 5 in the morning. Sometimes I'm like a person who likes to sleep in, which isn't true, but I do. I decided to have my surgery come in about 11 o'clock, so I could be early in the afternoon. I could sleep in a little bit. I can just come in the day of surgery. I don't have to come in overnight the night before. Well, I show up for the day of surgery with my spouse as my coach, and I'm admitted to the day of surgery unit. Look who's there, Janice, my nurse who I met 3 weeks ago that taught me all about my surgery. She's here admitting me to the hospital on the day of my surgery. And here comes the doctor, and the doctor, she's putting a check mark on my knee. She's asking me what surgery am I having, what side, and puts a little check mark and puts her initials on it too. That's reassuring, especially nowadays. It also, the anesthesiologist also comes in to do an interview on the day of surgery. Now, and I was explained all that in the teaching process 3 weeks before, but now I get to meet the anesthesiologist, and she also gets to talk about the special techniques they use for pain management, another big concern of mine from the very beginning. Am I going to go to sleep? Or am I going to get general? What am I going to do afterwards? All those kind of things. But it turns out the anesthesiologist is part of the team, and she knows exactly the kinds of things that we do as well. And it's a special technique where it's all spinal based, and they put some special medicine into the spine that actually works for about 18 hours. So you don't need the drips or the morphine drips that I've heard about other people having. And it controls the pain. And they even said, I'm going to get up the night of surgery and do some exercises at the bedside. So I thought this is going to really hurt. Well, after all that, surgery time is perfectly on time, even a little bit ahead of schedule. We go back. I say goodbye to my spouse, and the doctor sends my spouse up to a special family waiting area or family lounge that's right on the orthopedic floor. And it turns out we were offered and took advantage of the ability to go tour the floor that 3 weeks before when I came into the hospital. So I actually went up with my wife and looked at the whole floor and unit where we were going to be staying, so she knew exactly where to go when the doctor said to go to the family lounge. And I will call, and the doctor will call my wife up in the family lounge when the surgery is over. And this is where I am going to relay the story from my wife's perspective, because I'm out. So I go back, and I don't remember a thing after that for at least a few hours. But my wife tells me that the doctor, she called her up about an hour and a half after the start of surgery, and said that my surgery went very, very well, that I was in the recovery room, and that I would likely be there about 3 hours or so until I would join her up on the orthopedic unit as well. But everything went well. Talked a little bit about my bow-leggedness, how the arthritis was removed, the leg was nice and straight, and that prior football injury that I had, although didn't need surgery back then, caused a ligament problem that probably added to some of the wear and tear that created the kinds of arthritis itself. But there was no doubt it was necessary. So my wife is relieved. She knows she has 3 hours. They get her checked into my room upstairs. She actually has a list of activities that she can go. The family room, it turns out, has a massage chair for the family. It looks like my kitchen at home. Tables, it's a fully stocked refrigerator, lots of coffee and drink. And you have the ability to go off the floor and you just tell the nurses where you want to go. Like, my wife came back 3 hours later, and she was in my room waiting for me, basically when I was brought up from the recovery room. And she was amazed because I was wide awake. And in some ways didn't even look like I had surgery, although I was connected to some tubes when I came up. But I was in my bed already, that they had actually moved on to the recovery room, so I wouldn't have to transfer a bed from one to another. The tubes that she was introduced to the nurses that were taking care of her, who also kept her updated during the morning on where I was in the process. And the nurse without me having to use my muscles. And, you know, it actually feels pretty good. And it's really nice because the spinal's still working, too, so I really don't even feel all the pain. Anyway, but they showed me how I could bend my knee up to over 90 degrees on the night of surgery without using my muscles, and sometimes even more. And they also showed me that the machine actually has a control on it that you can control how much bending and straightening it does, and the pace as well. So they'll say, whenever you want to use it, you just let us know. We'll get you in, but we'll try to do it 2 hours at a time, you know, a few times a week. The other thing they explained to me that I didn't realize the importance of is my knee was also wrapped in this big black Velcro thing. Now, I heard about this ahead of time, but it's actually ice. It's a special ice pack that's used, and it actually was put on right after my surgery in the operating room, because ice and coldness is actually part of the treatment for both inflammation and pain, and it's very important to continue to use. And they showed in our room upstairs, there's actually a little freezer right next to the bed. And we wondered, you know, is this more food for the ice cream for reward? And they said, no, this is where your ice packs are. So that feel free to go in and use your ice. We want you to use your ice as much as possible, and you could do it yourself. And here's the freezer for you, too. So they start to explain, and then the rest of the night, I sort of used the CPM machine for a while, and the nurse came in and checked and saw how things were going. Sort of around 2 or 3 in the morning, I started to get some achiness in my knee. And the nurse came in and said, that's normal. The spinal is starting to wear off. We don't want you to get behind in your pain management, so why don't we give you some oral medicines right now? We don't think you'll need any morphine or anything like that, but we do have a bunch of different medicines that we'll do to use to control your pain. So I took a couple of the pain pills at like 3 in the morning, and I didn't sleep real well at night. I sort of woke up and went back to bed, but it didn't really hurt. It was just a feeling of restlessness sometimes that it seemed affecting what I just couldn't sleep. But, well, here comes the doctor, 6 in the morning now. She comes in the room, and she first asked me to wiggle my foot and ankle to make sure all the nerves are working down there, and then explains to me that, you know, she did her part the day before, but now it's time for the patient to do your part. And from that point on, there's a 2-a-day workout process that begins where I would go down to the gym on the floor. It's right on the floor that's in the unit up there. And you get to work out in a different atmosphere because you're going to be working out with other patients that had the surgery. And it just so happens, as I remember, I met these patients and their coaches 3 weeks before. And now we're all going to be in the workout room together doing 2-days, if any football players are here, doing 2-days on both hips and knees and doing a very group kind of exercise program. So in walks Megan again next day. And she starts you doing all these exercises. And, you know, they have this stationary bicycles in there. They have a treadmill in there. And she looked at me and said, did you know you were going to get on that stationary bicycle? I said, yep. First day I heard. So on the bike, first day, started going. I couldn't go around all the way the first time to begin with. But that's not a reason not to do it, because you can sort of go back and forth until it's time, until you get that motion in there. And then I saw that there's these steps in there as well. He said, well, you know, one of the biggest fears I had was going home and having to do those 15 steps to get back into my house. Well, you're going to be on those steps there and start working out. And we've used steps as exercise, not as an excuse not to do something. So you'll be doing steps for exercise as well as when you go home. So view those 15 steps as your first exercise in your home therapy program. And then also I looked over and there's a car in there, this mini car, looks like a VW sort of shell. And I wondered what that was. And I remembered, you know, one of the biggest fears I also had, since I'm expected to go home, is how am I going to go home? You know, I heard about my friends. They used to go to rehab centers. They would actually go to rehab centers in ambulances 4 or 5 days after their surgery. You know, and I'm going to go home in 2 days. How am I going to get home? What's my wife going to do? What about those steps? And said, well, Megan came over and said, well, you are going to go home in a couple of days, maybe 3, and you are going to get in the car. But we're going to show you how to get in and out of the car. so that when you do go out to the